A simulated environment like this one is valuable, but it only goes so far. Students need real-life experience in the real world, which they were getting until it came to a sudden and unexplained halt, and they just want to know, what's the deal?
This is how we deliver breaths in an emergency code.
Victoria Ornelas has always been passionate.
This will go directly into there.
About helping others.
Everything about healthcare speaks to me, the fact that I get to help people, but as well as advocate for those people. Like right here, this would be a simple mask.
But recently, she's found herself advocating for her fellow students at the College of Southern Nevada. That's because she and dozens of others pursuing their bachelor's degree in respiratory therapy hit a wall in their education.
I have a really big passion for pediatrics, and when we get further into our program, we have a whole area dedicated to that where we learn about it, and then we hit a wall because some of the best NICU places, such as Southern Hills and Sunrise Hospital, house some of the largest NICU units in Las Vegas, and we hit a barrier when we weren't able to get clinical experience in those places.
Southern Hills, Sunrise, and Mountain View hospitals are all operated by HCA Healthcare, the largest health system in the United States.
As a future respiratory therapist, I'm dealing with critical patients in critical scenarios, and you see more of that at these hospitals than you really do anywhere else in the valley.
Students like Victoria and Derek Hovda tell me HCA hospitals provide access to more specialized programs. HCA has also historically taken more CSN students for clinical rotations, a crucial component of medical education where students gain hands-on experience working directly with patients under the supervision of licensed healthcare professionals.
We had students going to HCA hospitals as well as Valley hospitals since as long as I can remember, and as long as the students have been coming into this program.
So this critical hands-on education that you were getting came to a halt without notice?
Without notice. The second years were informed about last year that they were no longer going to be able to go to the hospitals that they were already placed at. So not only was this a burden for the students, but for our professors and clinical coordinators as well, because then you're scrambling at last minute to try and fit X amount of students when you lose 14 to 30 spots in the hospital.
Which means more students vying for fewer spots at non-HCA facilities. Students currently in CSN's four-year program were not told about the change until their second, third, or final year. Prospective students are being given a heads up, and we're told it's resulting in fewer students enrolling in CSN programs. Victoria has been trying to find out why they've been cut off by HCA and what could be done about it, reaching out to the hospitals, CSN officials, and even speaking at a meeting of the Nevada System of Higher Education.
As students, our priority should be advancing our education. Yet here I am, pleading amongst you, because the students and faculty at CSN continue to be swept to the wayside.
Frustrated by a lack of answers, Victoria came to me at our Channel 13 advocacy fair.
And we have a little voice, so an advocacy fair was definitely something that we needed to outreach and get other people to hear what's going on over here.
13 Investigates got to work learning that contract negotiations between HCA and CSN are what's preventing CSN students from being able to do clinical rotations at HCA hospitals. Particularly frustrating for Derek, who was accepted as an intern at Sunrise.
I'll talk to the people in the RT department, and my boss will be like, hey, when are you guys doing clinicals here? You know, all the other interns are doing clinicals. We have to just say, gee, sorry, you know, we don't have the contract. You know, none of them know what's going on either.
CSN officials told us they have 300 active agreements with healthcare providers so students can get the clinical rotations they need to complete their programs. But both Victoria and Derek and many other students we spoke to say the other options don't measure up. They can go to non-HCA hospitals in the Valley, but say that limits their experience and ability to be career ready. For example, they could be doing rotations at long-term care facilities as opposed to emergency rooms or neonatal intensive care units.
Some of these students here, myself and my peers, are interested in progressing our education farther than just respiratory respiratory therapy, but becoming physicians. But when you don't give us a platform to feel supported, we might seek these options outside of Nevada when physicians are desperately needed here in the state.
Neither CSN nor HCA would tell us why things changed in their contract or what still needs to be ironed out. They also would not give us a timeline, but both say they're close to finalizing a new agreement. Some of our sources tell us that offers little hope, as they've been hearing that for 2 years. We'll stay on this until it's resolved. I'm Darcy Spears, telling you what's the deal.